So 26th question is, a 40-year-old lady complains of progressive deformities of her hand and fingers associated with stiffness which is present in both the hands and improves as the day progresses. On examination, there is symmetrical involvement of hands and fingers of both the upper limbs with flexion and ulnar deviation at the metacarpophalangeal joints. What is the most likely diagnosis in this lady? Osteoarthritis, ankylosing spondylitis, rheumatoid arthritis, and tenosynovitis. So what are the key clues? The first is that she is a female and 40 years. So generally rheumatoid arthritis is more common in female. So females is more common than the males. It is generally 3:1. Then we have the age. Generally the peak onset is from 30 to 50 years of age. So this is second clue. Third clue is that there is a stiffness which improves as the day progresses. So there is a morning stiffness which improves. So there is a morning stiffness which improves as the day progresses. This is in contrast to osteoarthritis, in which the pain is worse with activity and improves with rest. So this is in contrast to it. Now, fourth clue is there is a symmetrical involvement of hands and fingers of both upper limbs with. So this is the symmetrical arrangement. So this is symmetrical polyarthritis. So rheumatoid arthritis is symmetrical polyarthritis. And the most commonly joints involved are metacarpophalangeal joint, proximal interphalangeal joints, and wrist. So these are the most common joints involved. Then the fifth clue is ulnar deviation. Ulnar deviation at metacarpophalangeal joint, which is due to chronic synovitis in rheumatoid arthritis, ligament laxity, and joint destruction. So all clues are toward the osteoarthritis. That is the first option, which is osteoarthritis. So this is the rheumatoid arthritis, which is the C option. So this is the correct option. Going for other options, osteoarthritis is typically for the older age, around 50 years. There is involvement of distal interphalangeal joint, in which there is a Haberden nodes. Involvement is generally asymmetrical, not symmetrical. There is no prolonged morning stiffness. So there is no prolonged morning stiffness, and there is no ulnar deviation. So A is incorrect. Coming to ankylosing spondylitis, it generally typically occurs in young males. And in this, the joint which is involved first is sacroiliac joints. So the involvement joint is sacroiliac joints. And there is no symmetrical metacarpophalangeal arthritis, but it will present with generally back pain. The male will present with the back pain. So that's why the second option is also wrong. Then coming with the tenosynovitis, it doesn't explain symmetrical polyarthritis, so does not explain symmetrical polyarthritis, and there is no ulnar deviation deformity. So fourth is again wrong. So the correct will be the rheumatoid arthritis. This is the correct option. Some high yield points about the rheumatoid arthritis are that there is also swan neck deformity, in which proximal interphalangeal joint is in hyperextension, and distal interphalangeal joint is in flexion. Another deformity is Bottonier's deformity, in which proximal interphalangeal joint is in flexion and distal interphalangeal joint is in hyperextension. There is also Z thumb deformity, and there is ulnar drift. Ulnar drift means metacarpophalangeal joint deviate toward ulna. So these are the characteristic deformity seen in the rheumatoid arthritis.